I'm going to make this basically an in-depth overview of equine dentistry. I'm going to stay out of the politics a little bit, and I know that many of you have probably heard conflicting ideas about equine dentistry, and what I'm going to try to do is give you an overview of the past 20 years of what I've learned from a evidence based driven practice, and not just an opinion. I have the unique distinction of working with many veterinarians, but not being a veterinarian myself. I started out in equine dentistry as a lay person and then went to vet tech school, but considered myself, early on, what the long-term goals were in my business, and I realized that I wasn't going to be able to accomplish those if I didn't work with veterinarians and look at this from both a legal and a scientific standpoint. So the information I'm going to share with you is a lot of factual information, anatomy and physiology, and also the biomechanics of why we get dentistry done. So if you have any questions, just feel free to ask. So let me start here. So really quick with the history is equine dentistry is not a modern concept. I often hear people say that their grandparents never had their horse's teeth floated, and that may very well be true, but that's not because they didn't need dental work done. This painting is from 1648, a Dutch artist, and they are working on this horse's teeth to some degree, unsuccessfully. And if I try to work on horses today using those same tools and without sedation, I get the same exact response from a horse often. So the concepts are not new, but we just with anything medical, the more we've learned, the more improvement there has been made. Unfortunately, I feel often equine dentistry is one of the professions or aspects of veterinary medicine that is still in the dark ages in many regions of the country, and not just our country, but world. So starting out with the tooth anatomy, horses have hypsodont teeth, and that means that they are continuously erupting. And if you look at the comparison here, we have a human tooth versus an equine tooth. Horses' teeth are about 4 to 5 inches long. They have long reserve crowns and short roots. What that means is as they erupt, they're going to wear away. When you look at the diagram on the right, this is a young tooth, which is going to be 4 or 5 inches long, and then a geriatric tooth, which is almost void of that reserve crown. So your reserve crown is what is that basically the middle portion of that tooth. The clinical crown is what you actually see, which stays fairly constant until you get to that geriatric stage where you're only going to see a little bit of that clinical crown, which is usually going to be uneven by that age. And then your reserve crown, there's no more reserve left, essentially. So continuous eruption until they expire or the horse expires for other reasons. The positioning of the teeth are important. There has to be balance between the front teeth, the back teeth, and then the structures of the mandible and maxilla. The front teeth, which is what everybody can see, those are the incisors. There are 12 incisors, and those are for prehension and cutting. The incisors do not masticate or chew food. And that's important to know when I'm talking about horses who are naturally grazing. They're using their incisors to nip off grass. Our stalled horses are not doing that as much. Horses that are in smaller paddocks, that are not continuously grazing, they're not going to wear their front teeth or their incisors like a horse that is in a much larger field or wild horses. Moving our way back in the mouth, the next set of teeth that we come to are the canines. Canines are typically seen in male horses, but they can be present in female horses. So they can have between 0 and 4 canines. The canine's sole purpose is for defense. So they're long and sharp and unopposed, and those canines are meant to cause damage if a horse is fighting each other. Hence the stallions, always have canines. The next set of teeth, which a lot of people don't realize, would be the premolars and the wolf teeth. The wolf tooth is the first premolar, and it is unlike the other premolars because it's a single rooted tooth or it's not present. And that varies in numbers. You can usually have 2 wolf teeth on the top, but I've seen horses with a full set of 4 wolf teeth. Those are the first premolars, but they look completely different than the rest of the cheek teeth. The premolars that most people are familiar with are the larger teeth. I have a diagram after this, and you'll be able to see this clearly. They're going to be 12 premolars. After that, they're going to be 12 more molars. So they're between 44 and I'm sorry, 36 and 44 teeth in the horse's mouth, with over half of them shedding baby teeth and the other half coming in as permanent teeth. And I don't expect you to remember all the numbers, but hopefully you can refer back to this if you have questions. The cheek teeth are where all the grinding of foodstuff occur. That's where the majority of our dental issues occur. But like I said, we do need to pay attention to the front teeth or the incisors, because malocclusions will occur there. This is a great diagram. It really shows you the depth of those roots and those reserve crowns. Just by looking at this, you can tell that this horse was fairly young, because again, the reserve crowns and the roots are way up into the bone structure. You can tell that this was a female horse, a mare. There are no canine teeth, and this horse doesn't have wolf teeth. You can't see any wolf teeth in this diagram. You can see the incisors and how far back those roots go, which is important for extractions. It's actually very difficult to extract incisors. Here are these premolars I mentioned, 1, 2, and 3 in each row, 4 rows, so 12. And then the molars, first molar is back here, the second molar, and then the third molar. And one thing I love about this is it shows you the angle of the roots and angle of the teeth. And the horses have this unique dentition where the first premolar, technically the second one because there's no wolf tooth, and the last molar push against each other. So the forces, the biomechanics, are that these teeth are pushing and angling in towards each other to create a very tight formation. And as these teeth erupt, that formation gets loose. And that's one reason our geriatric horses end up needing extractions, is because they lose that reserve crown, and then the roots here and the reserve crowns are not able to push in tight against each other. It creates extreme difficulty to extract teeth the way the teeth are shaped. And that's why if you have especially a younger horse, your estimates for dental extractions are often in the thousands, because it is surgery and it is extremely difficult to get into the rear aspect of a mouth and get that big tooth up and out of there. Sometimes the horses can't even open their mouths wider or as tall as that tooth is. Some dental facts: horses' teeth erupt 2 to 3 millimeters per year. So what that means is they're constantly changing. Now that I've worked a little bit in small animal, I learned that rabbits, which have open hypsodont teeth, meaning that they're going to continuously erupt the rest of their life, their teeth erupt 2 to 3 millimeters per week. So I've actually been involved with some rabbit dentals this past year, and I definitely don't recommend owning rabbits over horses. But anyways, little side fact, the attrition or wear of the teeth occur with every bite. So you have this constant eruption, you have this constant wear, and that does not always equal each other. When you have uneven wear and uneven eruption, you're going to develop uneven teeth. The wear patterns of the horse are what allow us to age the horse. This is very subjective. It's much easier the younger the horse is, especially if you know, if you're looking at when the deciduous caps are shedding. That's pretty clear. You can get within 6 months of a horse's age. But as that horse ages, its nutrition, its amount of dental care or lack of dental care, all those factors can cause a horse to look younger or older than what it is. Here are a few other radiographs and CT images of teeth. Every tooth is made of the substances called the cementum, the dentin, and the enamel, with a living structure on the inside. That's the blood supply, that's the pulp. So the enamel is the hardest substance in the tooth. The cementum and the dentin are softer, more porous, and those parts of the tooth begin to wear away before the enamel. That's why you get sharp points. So when someone says, I just want the sharp points floated, on my horse's teeth, they're really only talking about the enamel. And what you need to know is that the cementum and the dentin is also wearing away. That also needs to be addressed, and not just the enamel. you can actually overfloat a horse and expose or overfloat the teeth in a horse and expose the pulp. If you expose the pulp, you have potential for bacteria to get in there, and then you can cause a root infection. You can damage the tooth, and it may be malerupted. It may not erupt again. So it's really important to know the age of the tooth, the signs to look for, and one of the things about the scientific background of floating, when you go to that, you really need to realize that if you take too much tooth off and you damage that, you may not get that back. And overgrowth, horses that have had years of overgrowth and their teeth are now many millimeters longer than they should be, can't always have those reductions done at one time because of the pulp. So it's very important to remember the tooth is a living structure. Note about angles here. When you look at this version, the upper teeth are actually a third wider than the lower teeth, and they're angled. So the surface, or the chewing surface, the occlusal surface of that tooth is not flat. So when we're working on teeth, there are lots of things that we have to remember. It's like putting together a very complicated puzzle. And if you were to go in and file these angles flat, that horse would actually have no contact with its teeth. Even if it has, it's not going to be able to chew as well. This is an x-ray of a young horse with erupting teeth, and 3 years old is probably the most uncomfortable age for a horse because they have this permanent premolar erupting in the middle between a permanent premolar in front and a permanent molar behind. So this is like I said, a 3-year-old horse, and that tooth has to push its way up in between those two teeth. And a lot of times horses are very uncomfortable with that. 2- and 3-year-old horses, you will often see what's called eruption cysts, the big bumps under the mandible. You can see them on the maxilla as well, but they're more commonly seen on the mandible. And again, you can look back here and you can see that last molar that is really angled in the bone there, and just comes in at a almost obtuse angle from the others. Diet and management definitely contribute to dental wear. Horses are designed to eat forages. They're designed to graze 20+ hours out of the day. And our domesticated horses, most of them would be completely obese if they graze 20 hours out of the day. The easy keepers, of course. It takes more pounds of pressure to eat hay than it does grain or grass. So when you have a horse, especially an older horse, and they're quitting, they're not eating their hay as well, that's because it hurts to shut their mouth and actually grind that hay when compared to grains or grass. Grass has a higher water content, so it's typically softer to chew. The lateral motion, the side-to-side motion, increases with roughage and decreases with concentrates. So what that means is a horse naturally chews more side to side. When they're eating a diet consisting of shorter fibers or eating grain, that biomechanics changes and it's more of a chewing motion like we do, up and down. So that contributes to the wear patterns on the horse. The ability to chew foodstuffs into smaller particles actually increases the surface area, which increases the digestibility of that food product in the gut. That's why our grains, when we purchase feed at the feed store, it's going to be rolled, crimped, cracked. That increases that surface area just over those grains, which increases the digestibility in the horse. So being able to masticate definitely affects how a horse is going to absorb nutrients from whatever it's eating. And then another thing to note, because this always comes up and people always ask, well, what do wild horses do? They don't get their teeth floated. Well, the simple fact is they don't live as long as our horses. And if they have dental issues, they're not going to survive. If they have major dental issues, they won't. They've done studies both in the American West and with the Brumbies in Australia. The average age is about between 10 and 15. They're not living to be 18 and 20 and 30. Horses succumb to other things in the wild. And I'd like to, also point out with these wild horses, like this picture here, they're often not in the best condition. I've seen some of the feral ponies along the East Coast, and they look kind of scroungy, really. So these beautiful Mustang pictures, they must get them at the height of the season, you know, when the forages are soft and they have the most nutrients, because horses really don't thrive in the wild like they do in our pastures at home. So I kind of titled this breed specific tendencies, but I'm going to go over. It doesn't mean that all these issues are only breed specific, but there will be, basically any horse can get any dental problem, but there are certain tendencies from different breeds, and I'll talk about that. When I talk about balance in a horse, when I'm looking at a horse and doing a dental, I want to make sure that the front teeth balance with the cheek teeth, and that the TMJ, that all those things are working together and allowing that horse to biomechanically chew in a natural and healthy way. I'll start with Arabians. They're my favorite breed. I'm very fortunate to have been involved with the breed, and that literally took me around the world and back. But one of the problems with Arabians is we have bred them to be a little extreme, let's say. And I have never seen more dental problems than I saw in the Arabian horse in the Middle East. And that is because we have bred them to have this huge dish in their face, and it has really affected their dentition and how their maxilla and mandible come together. They're prone to hooks in the front and hooks in the back, and as those hooks erupt, it actually can make them look like they have an overbite even when they don't have an overbite. And I've got some pictures coming up here, but the modern sort of halter Arabian show horse is so extreme. I have my horses are more Crabbit bred, which is an old English line, and they're not quite as extreme, but I do have one full brother to the others, and he will get hooks in the back just because his head is shaped a little more rounded here. So here's some photos of horses I've worked on. I actually do think all of these are Arabians, but I have seen horses of other breeds have these exact same issues. So these imbalances will negatively affect the horse's natural biomechanical process. If you have incisor issues, it is going to affect how the cheek teeth are able to masticate. If you have cheek teeth issues, it will affect how the incisors are able to go across each other and wear each other down evenly. All those things, all these dental problems are typically not seen until the late stages of the development. By the time you see a horse not eating well or dropping grain, they usually have had a number of years to develop these issues. One good thing about, at least on my behalf, about doing dentistry is there are no emergency dental issues. But almost every single dental problem I've seen could have been prevented with the proper early care and treatment of those dental overgrowths. If you have any questions, please interject. But these are all photos of horses that I've taken, and you can see this is what's called a ventral curvature. It's a very V shape. You can have the opposite of that. You can actually have a horse with an inverted V. Here's a lateral view where the incisors actually change angles. So you have one angle here and then a steeper angle there. To me, that indicates that horse is not having much lateral motion side to side in their mastication. Hooks, here are hooks on the left and right side. Those are pretty easy to take care of, but if you don't take care of them, they're going to grow longer. There's a longer, very sharp one. If it ends up just being a hook on the tip, that's a little easier to take care of than when the entire tooth is affected. Here's a huge ramp on this tooth in the front, which usually corresponds with a huge ramp or hook in the back. This particular horse has macerations on the inside of its cheeks here from sharp points. And if we just took care of the sharp points, we would miss all these other issues in the mouth, including this is a huge periodontal pocket up here. I don't think you can see it in this picture, obviously, but it had a big wave and a tooth down here, which basically caused this issue up there. Oh, here is a wolf tooth. It's a rather large wolf tooth, but you'll often find those wolf teeth adjacent and touching the premolar there. Ponies. Ponies are very similar shaped in head to Arabians, short and cute heads. They have less space in their oral cavity. It can be more difficult to get equipment in there, and it can be more difficult to get around the teeth in order to do even a routine float and reduce those points. Because they're easy keepers, you often don't see that they have dental issues. They can eat, air and get fat. So because of that, they're not using their teeth, they're not grinding, they're not having that sort of natural wear and attrition, and they will get sharp very fast. They're very stoic little creatures, and you often just won't see the symptoms of a pony having difficulty eating until it is so well formed in their mouth that it's going to take years to try to correct. For example, this is a driving pony that I did a couple of years ago. He was a champion Welsh Cob in Canada and also the US, both under saddle and in driving. He was fat. He had a body condition score of 7. The previous owners on the East Coast had him floated every 6 months by a dentist that they liked. And when I say dentist, it's really lay dental person. He did not need sedation and allowed this person to use hand floats. And they knew that he'd had an extraction at some point, possibly in Canada before he came down. And they noticed he was occasionally resistant to the right side. Once you open this pony's mouth, you could see this massive overgrowth on this premolar. Excuse me. And this developed over the course of, I would say, at least 5 to 6 years. At some point, this stallion had had an extraction. No one had maintained the teeth other than floating the sharp points and allowed the opposing tooth to grow down like a key into the socket below. He literally could not move his jaws left or right. Once that tooth locked into place in between the two lower teeth, it just couldn't move. So you have a pony that's stoic, one that is easygoing. He's a doer. He went and did his job, but he had a major dental issue that could have been prevented completely. Once you remove a tooth, you're not going to have even wear. You have a space. And when you have a space, the opposing teeth still erupt and have nothing to wear against. So this was one of the more extreme examples. Down below in this photo, I was able to reduce that tooth significantly without getting into the pulp. But he went on and did very well afterwards. Not that you could really see him eating or chewing with difficulty before, but you can only imagine what that felt like. Donkeys. I actually love donkeys, but they often have the similar issues to the Arabians and the ponies. They'll have rostral and caudal hooks. Rostral means to the front, caudal means towards the back. They typically have extremely large wolf teeth if they're present. They're a little, they've been not bred as closely as some of our other breeds, and they're a little more prehistoric, I like to say. Because of their short face and the stature there, they often have displaced teeth. The teeth don't always have room to come in the a straight row there. I've seen a lot of periodontal disease in donkeys, and I've seen a lot of dental issues in obese donkeys. They're just easy keepers. And I think everybody would probably agree with me. They can be difficult, and I actually want to change that term to different to handle. Donkeys are very predictable in handling them. They just react differently than horses. They often take 1.5 to 2 times more sedation because metabolically they process the drugs differently. Try to get a donkey to stand there for a dental when he has periodontal disease and displaced teeth, and he is going to put his head down and push you out of the way and walk right away from you. This is a donkey that was a body condition score 8 or 9, an obese donkey who they noted was quitting, so he was dropping some hay balls out. He never had a dental because he was a donkey, and the owners had the horses floated, but not the donkey because he was super fat. Unfortunately, this was the type of dental malocclusion and problem that is almost impossible to fully correct ever. So you have a ton of periodontal disease because you have displaced teeth. You have molars that had no room to go in when they were erupting. So they took the path of least resistance and erupted towards the palate, which then allows that tooth to overgrow because it can't wear evenly against the opposing tooth. It's more against the tongue. You have the caudal hooks, you have the rostral hooks or ramps, and just you have cavities, you have everything you could possibly want in a dental malocclusion in this donkey. And like I just want to reiterate, this was a fat donkey. Donkeys are stoic, and they need love and care too. Miniature horses. I know a lot of people drive miniature horses. They're very popular. They're very easy to keep. You know, a lot easier putting a harness on them than it is, you know, a full-size horse. And very rarely do I ever meet a miniature horse with normal teeth. We have bred them to be small. We have not bred them to have good teeth. So abnormal eruption, teeth that literally erupt on top of one another. We often get retained deciduous or baby teeth. Again, periodontal disease, difficulty because of the small oral cavity. You can only open the mouths up a certain amount, you know, depending on the individual may. And to get to the back of their mouths with equipment is a challenge. The equipment that I have is really unique in that I can get into tighter spaces, but a lot of the older versions of equipment, it's just too big and bulky to actually even address the teeth in the back of a miniature horse. Here are a number of photos of miniature horses with all these issues. A couple of these, most of these are photos I've taken. This was not, but I wanted to point this out. This was the only example I found of a miniature horse, you know, that seemingly the owners think, you know, it has an abscess, you know, its face is swollen. Maybe it's been bitten. Maybe it's had a reaction to something. But 9 times out of 10, when I've seen this, it's been food packing in to in the mouth next to even just sharp points, because again, tight little faces. There's just not a lot of room in there. Here's the crowding. Here are the incisors literally almost laying one on top of each other. The canine is even touching the incisors in this little guy. And that, you know, definitely affects how they're going to chew. In fact, his canines were inhibiting him from having lateral motion when he chewed. Here's another one here on the upper far right, and it probably had retained deciduous incisors at some point. So the permanent one said, all right, I can't go into that place. I'm just going to erupt it sideways and behind it. So now you have this little mutant there. Down below in the middle, we have underbites, which are a common issue in miniature horses. Genetically, they seem to have more underbites than other breeds. And this picture of the skull is not my photo, but it shows you an extreme malocclusion of a miniature horse with the underbite, as well as the displaced teeth and the hooks and the ramps. And that's just extremely common in miniature horses. And then here on the far right, on the lower, these are the hooks that I see in a high percentage of the cases that I work on that are miniature horses. And these can be taken care of. Like I said, almost all these dental issues can be prevented when they have malocclusions like this underbite. If we know that early on, we can take steps to prevent it from getting that bad. Which leads me to equipment. I mentioned it a little bit, but equipment really, really does make a difference. And I've done this for 20 years. I started out hand floating, unsedated. I'm a good horse person. I trained my own horses to national championships. I trained horses riding, you know, growing up, and I understand horse behavior. I'm a good horse person, but I can guarantee you that just because you're a good horse person doesn't make you a good dentist. And it certainly doesn't make you a good farrier either. But if you have certain malocclusions in the horse's mouth, or you have certain areas that need to be addressed, just being a good horse person is not going to remedy those issues. The hand floats, and I had this whole set of hand floats plus probably 2 dozen more. We started out this way, or rather I started out this way because that was basically what was available. That was the most commonly available equipment. And they are angled in different areas, and it takes manpower to do it. And I had, you know, good strong arms, and I still do, but The limitation with hand floats is when you have problems in the back of the horse's mouth and you need to get a hook in the back, you can't get the seesaw motion going effectively enough to get rid of those issues. And if you look at this skull with the file sitting on top of it, you have to imagine this horse would have soft tissue and gums in there. And if this hook was back here, or it was like this on the far right, you're going to bang the horse in the back of the mouth every time you try to take that down and get that seesaw motion going with that carbide blade. Versus if you have a diamond disc that is rotary like this, you can take this in, skip the teeth that don't need to be addressed, go back in here and touch the one tooth that needs to be addressed and leave the others alone. And that's extremely important in your geriatric horses because those geriatric horses have limited reserve crown and limited clinical crown that you can see. You don't want to overfile those horses. You want to go in and address the areas that need to be addressed, leave the rest of the teeth alone. And you absolutely cannot do that with hand files. You just can't. There are other shapes of files and equipment. So with the motorized equipment, you can have different heads. This is called an apple burr. And with that, you can actually go in with this apple burr and it's soft, or I'm sorry, it's smooth on the outside. So when you're gliding along the teeth, you're not catching it with you're not catching the soft tissue. And this can take little areas down that are just need to be rounded. You can do this little area here, or you could take that disc and go in and get that sharp point off. And maybe you just need to take a little bit of that point off at a time. You can do that with the apple core burr. Does anyone have any questions thus far? Okay, I'll keep talking. When we talk about the anatomy some more, it's not just the dental structure. I also have to consider, excuse me, the whole structure of the head, the masseter muscle. So when you have the more heavily muscled breeds, such as the quarter horses, your paints, and a lot of your warm bloods, you're going to have a very thick masseter muscle. And that thick masseter muscle will push the soft tissue in against those last few molars. And if you think of the shape, if you're looking head on at a beautiful, slender thoroughbred face, and there's actually going to be very thin muscling along the face. You compare that to a big strapping quarter horse, and some of those quarter horses, those foundation, lineage, they have just those chipmunk cheeks, those big, thick cheeks, and that horse is going to have completely different feel in his mouth. He's going to be more prone to cheek ulcers as the masseter muscle pushes against those sharp points that form in the horse's mouth. And they often will have the macerations and bite marks inside their mouth due to that. So, okay. Young horses, really interesting with those. Like I said, 3 years old is certainly the most uncomfortable time, I think, in a horse's life for dentition. Having those permanent teeth erupt is painful to some of those horses. And I like to say uncomfortable, maybe not necessarily painful, but I think it can be uncomfortable when they're teething. This is often when we're trying to train them, start their training, either, in harness or under saddle, we're introducing the bit to them. And even with having their teeth worked on, some of them will still be uncomfortable. And I really believe it's due to that eruption process. Their mouths are very active. They will have the bony inflammation happening from those roots and those teeth actively pushing up through that bone and into the oral cavity. And this x-ray here shows you it, here are the permanent teeth below, here are the caps, and there's a lot of activity going on in that horse's mouth. This is a caudal molar that erupted at, it's not fully erupted. It actually erupts usually at 4.5, but the root tips are still sort of open there. There's just there's the caudal molar. It hasn't erupted, but it's very, very active in the bone, and that inflammation, I think, can bother those horses. All those permanent teeth should be erupted by age 5. But you still have eruption that is a little faster in the young horse than you do as that horse ages. So they're going to shed 24 of those baby teeth and gain between 36 and 44 permanent teeth from the age of 1.5 to 5. That is so many changes and so many stages that during that time period, I highly recommend those young horses having dentals every 6 months. The teeth during that younger time period, they're actually softer. So it takes less force or effort to, say, file or float those horses' teeth, but it also means that it is going to change quicker and develop points sooner than a horse that is 7 or 8 or 10 years of age. So that young horse will only hold afloat for 3 to 4 months, 6 months tops before there are new changes and sharp points and new teeth actively in that horse's mouth. Here's an example of a cap. Here's a cap that's been shed with a permanent tooth pushing up through the bone. And here's a premolar cap. There are 2 of them here getting ready to shed. And you can see how uneven that horse's mouth is. I mean, if you can imagine that 2.5-year-old, starting out with a bit and you're trying to start to teach some concepts to him, how to carry that bit, how to carry the head, and everything's just going to be uneven. It's not going to be comfortable until those teeth are in full contact and fully erupted and at the same height. So you often see head tossing, resistance to the bridle. They're going to have difficulty collecting. You'll see dropping feed in these young horses. And it doesn't mean that they have a malocclusion, but it means that they are uncomfortable due to the caps or the uneven surfaces. And then a lot of horses that I've met are very head shy due to something happening in their mouth. Okay, moving on a little bit more to geriatrics, the other end of the spectrum. We're keeping our horses much longer than their natural lifespan. I had a quarter horse that I got when I was 10 years old and she was 8, and I had her until she was 38. So she was with me for a significant portion of my life, and I got to see her teeth change throughout her life. A lot of my clients that I've been doing their horses for 20 years, I've worked on them and seen their changes. And the horses that I've been able to work on from an early age, a lot of them still have good dentition, even though I knew less when I started. But, if I start to work on a horse and he's not getting his first dental until he's 20 or 25 or 30, it's not going to be the same. Those changes and those wear patterns have not been balanced through the life, and you'll get a case like this horse here where everything's just expiring. These are root fragments. There's not even a full tooth left in this horse's mouth, even though there are root fragments from every tooth. This horse essentially has no contact, no occlusion. This picture of this pony, that's Henry. He actually lived to be 41. He was one of my clients' horses in Maryland. So I like to talk about form to function, because if you think about what a horse naturally does, he doesn't walk around with his head in a bridle and collection. They have their head down, which allows the mandible to drop forward. They look around, they run around, but they're not being asked to perform and carry their heads in the ways that our driving and riding horses are. So, for those performance horses, they need to be able to move their jaws both left and right and forward and back in order to be comfortable. If they have any of those malocclusions like I showed in previous slides, that's going to inhibit the physical ability of that horse to be able to move their jaws. Biomechanics, when you start at, a lot of people have chiropractics, they have acupuncture done, they have horse massage therapists, and they're wondering why their horse isn't moving so well. And a lot of times there are other issues in the horse, but you really should start at the front of the horse. Start with his mouth, because if they are stiff in the jaws because they have a malocclusion, because they can't physically move their teeth or move their mouth, that is going to affect the horse from the poll backwards. So I think I've tried to make this point, but it is a complete myth that floating a horse's teeth is all the dental work they're ever going to need. If that was the case, gosh, it would make my job so much easier, I think. But just floating the horse and taking floating those teeth and taking the sharp enamel points off do not balance the mouth. It knocks points off, and it may make them a little comfortable, that soft tissue is not being pinched or abraded, but is that horse able to biomechanically move its mouth in a balanced motion? Probably not. I would rather have a horse with a balanced mouth and sharp points than a horse that had the sharp points removed but had major steps and waves in that horse's mouth. And I often see that. Little side note here, bit placement, and I actually learned this from the driving barn I worked at many years ago. And I started working on horses and floating horses' teeth, and there was often the complaint that the horse was mouthing at the bit, or he just wasn't happy with the bit. And I would float the horse's teeth and try to address all that, and then he still wasn't happy. But I did learn from a carriage driving horseman how he judged where the bit would go, and he would always put a sort of a thumb's width between the first cheek tooth and that mouthpiece, and the upper picture there actually looks a little too high. Sorry, was there a question? Okay, thought I heard something. But the higher the horse's bit is in the mouth, can make it a little bit more comfortable. I don't want that bit up against those teeth. And there's a misconception that a bit seat makes the horse more comfortable. The bit seat has nothing to do with the bit. It has to do with the bit sliding soft tissue back onto a sharp edge. So you round those teeth a little bit, those premolars, so that you're not pinching something, not because the bit's going to sit there. But what I've noticed is horses are very sensitive in their incisors. When I do incisor work, it usually takes a little bit more sedation or analgesia. When I examining a horse, I notice that they're more sensitive at the front of the mouth than when I just have my hand in the back. And if you have that bit closer to the front teeth than you do the cheek teeth, that horse will often be very uncomfortable. And I've found this to be true with driving horses, with barrel racing horses, pleasure horses. Is if a horse is having issues with the bit, sometimes bringing it up in the mouth a little higher, so that it's about 3/4 of the way up on the bars, will alleviate those issues, even when they haven't had a dental. So try that next time. So talking about these bit seats, are they necessary? There was sort of, I think through the late 80s and maybe through the 90s, somebody said, oh, we're just going to create these bit seats and it's going to make the horse more comfortable. And so they started aggressively filing those premolars, like in these photos, and thinking that that was making the horse more comfortable with the bit. Well, what they didn't realize was that the tooth is a living structure, and by filing those teeth back so far, they were actually exposing those pulps. There are 5 pulps in a premolar there, and they're small, but those blood supply, those pulps can get affected, and then that tooth takes sometimes months to years to show sensitivity or become compromised and die or stop erupting. So aggressive bit seats are not necessarily. When I work on a horse, I don't even call it bit seats anymore. Basically, I just want to take and buff any sharp edge on there, but not reduce the width of the tooth. And you can see in these photos is the tooth is actually reduced so much that there's less contact between that upper and lower tooth than there ever, should be. You're reducing the occlusion by creating aggressive bit seats. So the goals for any equine dental provider, you need to achieve balance. And again, starting with the incisors, the cheek teeth, and that correlates to how the TMJ can work. And every horse needs to have a full oral exam in order for you to see balance. And if you don't have, if you're not looking and you're not able to see what's in the mouth, you're definitely going to overlook something. I listened to a podcast recently of a veterinary dentist in the UK, and she said, without a good light, if you're not looking, I guarantee you're missing something. So those dental providers that are like, well, I don't even use a speculum, of course there's no dental problems in that horse because they don't see it. So, and I think that's the problem with a lot of owners is you as owners, you're not seeing what I'm seeing necessarily, or what the veterinarian or the dentist, is seeing. And you need to know, I want you to understand the biomechanics and what it should look like, because it's hard to see in there. And having a good light source, so you can do a full exam, an oral exam, is step one in trying to achieve that balance and knowing what you need to do and address. You need to use a licensed, experienced provider. There's a lot of politics in equine dentistry, and I don't have time to go into that, nor do I want to, but find people who are open and take regular CE and go to conferences where it's not just someone's opinion, but there's some scientific background in what they're learning. And, don't be afraid to choose somebody who is more modern, because the modern equine dental principles that we have now, I've gone to international conferences, and it's an issue worldwide where people are like, well, I just want my horse hand floated with hand tools and no sedation. And that's not really the standard of care anymore. I'm not saying that there aren't horses that can be done that way and be just fine for a number of years. And believe me, I did that in the beginning of, the first 10 years of my practice. But we do need to constantly move forward and realize that we don't want to continue using antiquated practices in anything involving, equine dentistry or veterinary medicine. Colic surgery has changed immensely since it first started in the 70s. And you certainly wouldn't want to choose a surgeon who's practicing the same colic surgery he did in the 70s. So here's a collage of photos of horses that I worked on in the Middle East, just to show you a comparison of cheek teeth issues and incisor issues. And one of these horses is a $30 million Arabian stallion. Actually, there's two $30 million Arabian stallions in these photos. Neither of them had normal mouths, and both of them had traveled the world, both in the US and Europe. They'd been through Rood and Riddle. They'd been through some pretty, big practices in Europe as well. And dentistry didn't seem to be something that was done to the standard of care that one would think that a $30 million horse, should have. So just wanted to throw that out there and show you some pictures. I'm open to any questions. Hopefully I have been able to share some new ideas and well, just new facts with you.
I haven't seen any questions in the chat, but if anyone wants to just verbally ask it now, you could unmute yourself. I'll have a question or comment. I had a rescue Belgian horse that I probably had never been floated at all, had never had any dental care. And he was, about 8 or 10 years old. And I had a equine dentist float him. And about a week or two later, he had a major colic from an impaction and he had surgery. Mm-hmm. Is that probably related to his teeth being floated and now chewing things more thoroughly than he had been able to before? I mean, is that something to be aware of if you have a horse that may not have been recently cared for from a dental perspective?
They could be two completely different things. Having worked at Equine Hospital for 15 years, we'd have horses come in and have colic surgeries, two different types of colic surgeries in 1 week. So colic is one of those things that can just happen. Impaction colic is often because they either aren't hydrated or they're not able to chew foodstuffs and allow those particles, to get broken down in the mouth first. Horses with dental problems, horses with lack of occlusion or contact are more prone to impaction colic, and without examining his teeth, I can't say that, maybe he had a really good dental provider and had a good float, but I wouldn't think that the colic was the result of the dentistry. I have seen horses who colic because they had poor dentition. But you know, it's hard to say that it really could have been just a completely separate incident and not correlated to his teeth. But you know, there is a higher incident of impaction colic with older horses or horses with poor contact.
Okay, thanks.
I have a comment,
Hopefully that
if I
answers.
might.
Yes, go ahead.
I totally enjoyed this whole presentation. I was one of those, I'm of an ancient age and was totally dependent on my favorite horse, you know, with the old tools. And my vet changed my mind when I got a new pair of horses, and the one particularly flipped his head a lot. And I, you know, I didn't want to go through the anesthesia. It's expensive. She uses the tools that you do. And she's a vet that is very, very particular about dentistry. And she opened the horse's mouth. She had the you know, thing so I could look at it. She said, "Now look at this, Louisa, look at it." And the whole inside of his, outside of his mouth was totally scratched up. She did the horse. I hooked him up the next day with a pair, and he never flipped his head again. So
Yeah.
But I am totally impressed by all the pictures, and I'm wondering how in the world you ever got those pictures so far back in the mouth. But it was an excellent example, and we could actually see it. Thank you.
You're welcome. Thank you so much, and for sharing your experience, because that's so common. Is we're reluctant. I was reluctant to work on horses sedated, and it's like, I don't need to do that. You know, I want to learn how to do this and be that good horse person, and you know, I'm tough, and I didn't choose to go and change my practice and protocols, and because I wanted to make it easier on myself, I wanted to do what was best for the horse. And I'm so glad that I partnered with veterinarians very early on, even veterinarians who were like, you know, well, I won't get into the politics deeply, but there are still veterinarians who don't believe that horses need to be sedated for dentistry, even though at their disposal they have sedation. And one of the main things about sedation that a lot of horse owners may not realize is it provides analgesia. In order to do the proper job with a lot of horses, especially your geriatric horses or horses that have cuts in their mouth, you need to have the pain control there. If you don't have the pain control, you're not going to have a horse that is going to be cooperative. Even those thick quarter horse cheek muscles that have all these macerations, and you're sliding a hand float in there, that it has to rub against that soft tissue, and it's going to rub against those sores in the mouth. And I've seen horses tolerate half a dental and then say, yeah, I'm done. I've seen horses with neck issues who can't put their heads up. And so I'll sit on a stool and use a dental halter and work with them within their limitations. You know, we don't expect, you know, our geriatric people to be able to run up and down a set of stairs, or, you know, we help people with physical limitations. We need to help the horses, especially the geriatrics, with their physical limitations. But having analgesia on board is a good thing. When you go to the dentist and your mouth hurts, he doesn't just say, well, hold still, let me pull this tooth. And, you know, we expect more, and we need to expect more out of our dental providers for the horses. And that means that we need to change our perception as owners. And it took me a while to do that. One of my best friends is a veterinarian, and she has a 28-year-old thoroughbred that she loves. I mean, she would spend 15 grand, 20 grand on colic surgery for this horse in a heartbeat. And she's had to change her concept of dentistry as we've worked with him, because he didn't need sedation for years. And then I start working on his teeth, and she's like, well, I really don't want to sedate him. I'm like, well, I can't get into his mouth, you know, and now he has periodontal disease because he also has metabolic issues and Cushing's, which lead horses, they're more prone to systemically having periodontal disease. And the difference in him now, because he's changing and he's getting older, is significant than when we started working on him 10 years ago. And we've, you know, I work with her in coming up with a good sedation protocol. I've listened to Dr. Lori Bidwell, who's a boarded veterinary anesthesiologist, and I listen to AEP talks. I don't just listen to dentistry talks. I listen to nutrition and pain management, and analgesia and sedation, so that I can understand that, even though legally I'm not the one sedating your horse. I'm working with the veterinarian. And my experience of working in equine hospitals and having a little more access to sedation, because the vets are always there working with us, has been a wonderful experience, because again, we want to provide the analgesia for our horses. We want to do what's best. When I put that into perspective financially, is, you know, really we're asking you to spend about $150, maybe $200 per horse for its dentistry, and that's going to last you a year. When you are asking your farrier to come out every 6 or 8 weeks at $45 a trim, you're already spending minimum $300 to $400 a year on their feet. Spend half that on their teeth once a year and have a good provider, and I guarantee you your horse is going to live longer. Because the truth is, horses don't need farrier care. They don't need dental care in order to walk around and eat. They're just not going to live as long, and they're certainly not going to be comfortable if you don't. Any other questions, comments?
So Amanda, this is Susan, when you have a geriatric horse, are you always kind of who doesn't have much tooth left, let's put it that way, are you always trying to balance how much you're taking off versus how much is left, probably in the horse's mouth?
Absolutely. Absolutely. You need to be conservative but effective, and in many of those horses, our goal is to make them comfortable and leave them with as much function as possible. But you realize you're losing the occlusion, you're losing the contact as that horse's teeth expire.
Mm-hmm. Yeah,
and
because
even in our go ahead.
I was just going to say, I've seen a lot of them that will be dropping their food and they've gone to forage instead of, you know, hay, regular hay, because they can no longer chew the hay, properly.
Right. We can't expect all of our geriatric horses to continue to masticate normally. They can't.
Right.
I worked on a horse today, and she said, you know, he's been quitting, and he was better, you know, after the last extraction we did. And I examined him today, and his teeth are expiring. They're getting shorter. He has more enamel loss this year than he did last year. You can't realistically expect our horses to eat as normally and as well as they did when they were 15 or 10.
Yeah.
So our expectations have to be realistic, and quitting can be a sign that quitting is a sign that they don't have good contact. Now, do they not have good contact because they have a malocclusion, or do they not have good contact because of the loss of enamel? There are a couple reasons that can be that they quit. Mm-hmm. Or they have big spaces in their mouth that food gets stuck in, and then they spit it back out.
I have a boarder here, and it's a thoroughbred mare, and she's, I don't know, 27 or older. She was very bad condition here. A friend belonged to a friend who passed away. Anyway, my vet said there was so much unbalance between the top and the bottom. She said she would not take off and make it balanced in one time. So she's been doing it over like a year and a half, a little bit at a time, to try and make it better, but not make it drastic. Is that something you would agree with?
Yes. Absolutely. Often, you know, these horses didn't develop these issues overnight, whether it's a 7-year-old with rostral hooks or a 37-year-old with a wave mouth, they did not develop these dental issues overnight, and you're not going to correct them in one go.
Yeah, absolutely. I agree. And the horse has gained weight and looks probably better than she has in years. But
Yeah.
I would have never, ever believed that I would change my mind. And yes, it is expensive to have the horse done that way, but the results are really incredible. Even if the horse isn't showing outward signs of being really uncomfortable,
Right.
it's amazing. It's amazing how much softer they can become in the bridle.
Yes, we have to change our concept of what dentistry was, or how the horses need to be. Like I said, being realistic about a horse quitting. We're not going to put dentures in their mouth. You know, they're getting older, and a 30-year-old horse is the equivalent of a 90-year-old person. You don't expect them to be able to eat the same things, or behave, or physically, like they did 60 years ago. And our expectations about the cost need to change. Comparing equine to small animal, there are huge changes. A small animal routine dental is $800. That I know it's expensive, but it's proven that dental care will help your pet live longer. And the same thing with horses. And like I said, $200 a year or less is not a lot to ask when, entry fees are that much at a combined driving event. So,
well, I will reiterate your pictures and your slides are absolutely phenomenal at explaining what a
Thank
lot
you.
of us are too stubborn to listen to. Thank you.
We're all stubborn horse people, all of us, myself included.
Well, I guess I got reborn about 4 or 5 years ago after my vet about hit me over my head a number of times, and we're good friends. But anyway, thank you.
I have a question from the chat window.
You're welcome. You're welcome.
I have a question from the chat, and the question is, at what age do a horse's
Yes.
teeth stop erupting?
They never really stop erupting. They slow down, and they continuously erupt and expire and wear down at the same time. But the rate of eruption, and I don't have a solid scientific answer on that, but I know it's 2 to 3 millimeters per year. But I would guess that after the age of 20 to 25, that it would maybe be half that. And don't hold me to that number, but it's definitely slower. So a young horse is going to erupt much quicker, and I'll recommend a twice a year float to check for those changes, especially when they're shedding caps. And I know that basically it will hold a float for about 6 months, and they'll be really sharp again a year. Whereas these older horses, I'll go back a year later and they're not that sharp, but I'm doing the examination for periodontal disease. I'm looking for cavities. I'm looking for teeth that are expiring. Fractures spontaneously sort of happen, especially if your horse has metabolic issues. And I'm looking for sticks in the horse's mouth. I've found horses that had something, a foreign body lodged in there. So if you're not looking, you don't know what's going on. So even if they don't need a lot of work, as they age and their teeth are still pretty balanced, you're going in and doing those little things so that you don't have big things in 2 years' time.
What do you do when you find cavities? Do you fill them just like a person's dentist does?
Well, I don't, and I don't. I never got into that. I know that there are some universities that have veterinary dentists, equine dentists, specialists who are doing that sort of work. I think that's above and beyond anything I could do legally in any state. And I think they have done it with more success in recent years to preserve teeth, especially for teeth and incisors. I've seen some case studies where they've done it in cheek teeth, but you would need to consult someone that is, at a university who's experienced in doing that. It's not something that the average veterinarian or dental provider practitioner is going to offer, but it is out there, and restorations, things like that, they are being done. The problem is the teeth continuously erupt, so you fill a cavity and the tooth is still going to erupt. So, and wear away whatever filling you put in there.
I had a 34-year-old Clydesdale thoroughbred that right at the end of her life, she had no teeth left. So we had to do the, mash, and she ate that. And then the equine dentist decided the last time she was supposed to have her teeth floated, there just wasn't anything there left to, and she didn't live very long after that anyway. But I had a question, because you deal with Arabians a lot. We had our Morab, one of our pair, we had to put down because he had ethmoid hematoma. And I was wondering, I understand it's rare, but it's more common in thoroughbreds and Arabians and stuff. Have you, and because it's all kind of related to sinuses and with the mouth, have you ever come across that at all?
Yes. Sadly, my first Arabian horse, he developed ethmoid hematoma when he was in his teens. That was how I ended up being introduced to the Equine Medical Center in Leesburg, Virginia Tech's veterinary teaching hospital. I was in college, and there he had formalin injected into it. It shrunk, went away for another 10 years or so, and then sort of came back. And at the same time that it came back and we started the nosebleed again, he also had squamous cell carcinoma that had infiltrated in his maxilla. So he had surgery and had a nucleation, had that removed, and basically the surgeon, Dr. Ken Sullins, he's like, you probably get like another year out of him. So between the two issues, we ended up having to be euthanized. But ethmoid hematomas can be small, they can be big, they can be problematic. I've seen that in the hospital setting as a nurse, and they, sometimes treatment is successful and sometimes it's not. So
yeah, ours was too massive by the time it was caught that it wouldn't have been right to put him through that. And it's such gory surgery because they would have had to go through the skull.
Yeah, there are things that I see as a technician going out to do dentistry that my experiences working in the hospital have benefited me so much, because sometimes I'll get called out, horse isn't eating well. And even the veterinarian said, oh, I need you to come out and float this horse's teeth. He's not eating well. And I take one look at the horse and I'm like, he looks neurologic. And I'm not diagnosing that, but I can tell if the horse is not behaving correctly. And if he's not eating correctly because he's neurologic, that's a whole separate issue. And maybe he needs his teeth done, but they don't need to be done now. We need to take care of the other issues. And I've actually come across a handful of horses in 20 years where I refused to do dental work on them because they systemically were not healthy enough to work on. And that's something that needs to be taken into consideration. I'm looking at the whole horse from the time he comes to me, and I'm not a doctor, but I need to know where my limitation is as a technician. And if I work on this horse, is that beneficial or detrimental in this particular horse's case? I'm not going to work on a pregnant broodmare late-term gestation. It doesn't need to be done. Dentistry is, for the most part, a routine procedure. And I know dentists in Virginia that are adamant that, the barn owner, oh yeah, we just got broodmares done at the same time right before they fall. Why risk 11 months of gestation for a routine dental? Dentistry does stir up bacteria. That something like that. And the horse, again, I've seen your rescues, they're not healthy enough to sustain dental work until down the road. So like I said, there are no dental emergencies. Apart from a horse being kicked and needing a surgeon to repair its jaw or extract teeth, there are no dental emergencies.
Do we have any other questions for Amanda right now?
Well, I really appreciate everyone's time and listening to me, and please go out and spread the word why dentistry should be done and constitutes, a good provider, because, it really can help your horses be comfortable and live longer.